Good morning. Thank you for joining our community in this Black Health Town Hall. We in the Tri-County Health Department are excited to be partnering with the Aurora Branch of the NAACP and the Colorado Black Health Collaborative to host this community discussion. We're also grateful to Westward, Denver Urban Spectrum, and the Drop for promoting and letting people know about this event, and for Susan Burks and her team at Burks Communication. Our goal today is to share and discuss current information about COVID-19 and the COVID-19 vaccine, and to talk about issues that are of particular concern to members of Black communities. For those joining us here on Facebook Live, we'd also like to hear your questions and get you the answers and information about resources that you've come for. We'd love for you to post your comments and questions in the comment column below the video, and feel free to ask any question that you have. We're joined today by Mr. Omar Montgomery. He served as the president of the Aurora NAACP, National Association for the Advancement of Colored People, for the last 5 years. He's also the director of Equity, Culture, and Community Engagement for the Cherry Creek School District. Mr. Montgomery, would you like to start us off?
Thank you, and thank you for that warm introduction, and thank you for all that's here joining us. Let me say this, the Black Health Town Hall put together by the Colorado Black Collaborative, the Aurora Branch of the NAACP, and Tri-County Health Department. This is an amazing event because we are at a time where we see a lot of people getting vaccinated, but there's still people that's hesitant. There's still people that's trying to figure out, should I go ahead and take that step? Should I get my first shot? Should I get my second shot? Questions about Johnson & Johnson, the first shot. Right here, your questions can be answered. And let me say this, health disparities in our community has been with us for a while. But I must say, there are doors of opportunity now, not only for healthcare to be changed in the future based on what COVID has done to our communities, but also an opportunity for us to access some of these resources for free. With that stated, I look forward to seeing all these disparities disappear so that we all can have healthy lives moving forward, our families can be healthy, and more importantly, we can begin to hug, we can begin to love each other and not talk to each other through a window. With that stated, I want the experts to take it from here so that you can ask your questions and we can go ahead and move forward and get our communities vaccinated and have them have confidence that this is the way to move forward so that we can be healthy. Thank you very much.
Thank you, Mr. Montgomery. Real quick before we move on, tell us why you got vaccinated.
I got vaccinated. I'm not gonna lie, I was one of the hesitant ones. I was like, let me figure out any excuse to push this out to like June to July. First of all, I'm a sci-fi movie fan. So I was watching the movie I Am Legend, and I didn't want to become one of the zombies that Will Smith was trying to take care of. So let's understand that first. So I'm up here watching I Am Legend, and I'm like, just, saying, that started out because of vaccination. But then I had a conversation with my father who lives in Los Angeles, California, and my mother. I would go see my mother who lives out here, and we could only hand bump, couldn't give my mom a hug. I hug my mom every day. I go by there almost every day. I give my mom a hug every day. And then my father told me, he says, son, if you come visit me, you're going to have to stand outside if you're not vaccinated. And I was on the phone and I said, are you serious? He said, yes. So I said, to hug my father, to hug my mother is the most important thing to me. So with that stated, and Dr. Terri Richardson did a town hall with the NAACP. There were some other doctors on there. After that, I was convinced this is the way to go. So that is the reason why I got vaccinated.
Great, thank you. Next, I'm going to introduce Dr. John Douglas. He is the Executive Director of the Tri-County Health Department that serves Adams, Arapahoe, and Douglas counties. He's been our director for the last 8 years. And before that, he served 10 years with the Center for the Disease Control. Dr. Douglas, if I missed something, feel free to add to that. But we have some really tough questions for you. One of the first questions that's kind of in the news right now is with mask orders going away, Should we be concerned? And is it okay to still wear a mask in some situations?
Yeah, a really timely question, Becky. Thank you. First of all, let me just say I'm really glad Omar still listens to his father. That's great, and all of us should listen to our parents and to our children. I think the change in the mask recommendations by the CDC a few days ago, and then the change in the mask requirement by the governor yesterday, is probably appropriate in terms of the timing. I do think we have to be smart and not just assume that with those mask recommendations and requirements going away that everything's over. I keep hearing people say the pandemic's over. It's not over. It's not over in this country. We've had a couple of thousand people die in Colorado since January when we've had the vaccines. We're still predicting, hundreds more may die despite our best efforts. So I think we got to be aware that things are not over yet. I do think that if you're not vaccinated, you should be wearing a mask in public settings, both to frankly protect yourself, but also protect other people. We've always thought masks work two ways. I think one of all of our concerns now is that we don't have any way to identify whether the person standing next to me in a store who's not wearing a mask has been vaccinated or not. Both the president and the governor said we're going to rely on an honor system, and we'd love to believe that everybody will behave honorably, but I think we all have to realize that that's not always going to be the case. I would say that, again, if you aren't vaccinated, first of all, do what Omar decided to do and get vaccinated. Secondly, while you're thinking about it, making up your mind, getting ready to do it, wear a mask in public places to protect yourself and to protect others. And then thirdly, if you happen to live with someone who has got an immune system problem, or if you yourself do, where we think vaccines work, but may not work quite as well as they would in folks with normal immune systems, you might take that extra step and wear a mask to prevent transmitting infection to them. It is absolutely okay to wear a mask in some situations. Those are some of the ones we've identified. Dr. Fauci, the NIH person that I listen to probably more than anybody, reminded us we've had the wildest flu year this past year that we've had in recorded history. And that's almost certainly because we've been wearing masks. And I think that it may well be a smart thing for many of us to do during flu season, not because of political correctness, but just to kind of keep ourselves safe, to be thinking about this for the future. So really important topic. Thanks for asking, Becky.
Great. Next, I'm going to introduce Dr. Alex Enurah. He is a internist. No, not an internist. Sorry, got that wrong. He's a hospitalist with the Critical Care and Pulmonary Consulting Group. And he is going to share a little bit of his own personal story with COVID and what it's like to be on the front lines. So, Dr. Enurah, please share.
Yeah, wonderful. Well, thank you very much for having us, and thank you very much for setting up this event. This last year has been an incredibly tough year for many of us. From when this all began to when we first started hearing of the cases and not really sure, when to anticipate, what to expect, to just, when hospitals were full of COVID-19 patients. I've had the privilege and honor of being able to be on the front lines, taking care of many sick individuals in the community. COVID-19 is a virus that spreads very, very easily. And one of the big issues we saw is that because many people were asymptomatic, meaning not having any symptoms at all, it was very easy for it to spread to many populations, many vulnerable populations. And in the hospital, we would have people come in of all ages and backgrounds, many of them shortness of breath, struggling to breathe, having high oxygen requirements. And what we were seeing is the communities of color were being hit really, really hard at the time. And I would have patients where both mom and dad would be admitted to the hospital. Mom would be on 6, 7, 8 liters on the floor when dad, his oxygen requirement would go up and up. He would need to go to the intensive care unit, need to be intubated, and in the end he still may have then passed away, and then mom was in a prolonged state in the hospital for a while and finally got home. I witnessed many families torn apart, many loss of lives, and it was a very, very humbling experience. And last year, I actually had gotten COVID-19. I remember at first it was just, I was feeling really tired, really weak. My joints hurt, my body ached. I had this fever that just simply wouldn't go away. And I was isolating at home in the basement, actually in the room right behind me here. My wife was taking care of me, bringing meals down. I wanted to isolate because at that time, my wife was about 35 weeks pregnant with our little girl. And I just started getting weaker and weaker and finally started getting short of breath. And I had reached out to my colleagues at Critical Care and Pulmonary Consultants. And they decided, one of my colleagues, Dr. Katara, actually came to my house and took me to the hospital because I just did not have the heart to call an ambulance and have my wife see me leave in an ambulance thinking that might be the last time I see her. And they brought me into the intensive care unit. It was a terrifying experience. Every time I would cough or laugh or talk, my oxygen would just drop down. And I remember sitting, laying on that bed, looking up at the TV, watching the news. And it was around that time last year that they were saying, we're seeing that the Black communities, the Hispanic communities are doing significantly worse. And I remember thinking like, wow, I may not get a chance to meet my little girl. I may not get a chance to see my wife, see my son again. And I thought, should I write a letter? Should I record a message to this little girl? Luckily, at the time, I was able to slowly get better and be moved to the floor. But I remember just being so terrified because I would hear code blues going off around me. And I knew that other folks were not as fortunate as I. And then I got home after 7 days in the hospital. And here I am in my early 30s on an oxygen tank. I would try to go outside to, look at the garden, maybe try to work in it and almost pass out and just felt so weak. And I lost quite a bit of weight. I will say that weight came back with a vengeance with the way the year has gone, but it was a humbling experience. And one of the reminders for me is my son, Hans, and my wife made a sign on the door of my office, and I kept it up there, "Welcome home, Dad," as a constant reminder of what we've been through, what we have overcome. And for me, I had always had a bit of a fear, when I would go back to seeing patients in the hospital, particularly when I would walk by the ICU room that I was in. And again, I was doing everything right, wearing a mask, keeping social, physical distance, washing my hands, take off my clothes when I got home, make sure to keep my family safe. And, I had still gotten it. And for me, one of the most important things for me was when I was able to get my vaccine, because it felt like now I had this layer of armor underneath, something that protected me 24/7, something that gave me the courage to go back into those rooms and take care of the patients who are suffering from COVID-19. And it also felt like now I have an extra protection for my family. The idea with the vaccine is it's one of the most natural things one can do, because what it's doing is it's training your body's own immune system to be able to recognize a threat so that when it's exposed to that virus, it has the antibodies ready to go, ready to protect you. And so it's just gearing up and priming your own immune system to protect you, which we've been doing for years and years and years. And so I'm, I count myself very fortunate to be here today, being able to talk to you from my experience, both being able to take care of patients in the hospital, and then also my own experience being a patient in the hospital.
Great. Thank you very much. We appreciate you sharing your story with us. Next, I'm going to introduce Dr. Terri Richardson. She is an internist at Kaiser Permanente and lead physician for the last 17 years. She's also vice chair of the Colorado Black Health Collaborative. Good morning. Thank you for being here. Can you tell us a little bit about the role that health disparities have played in the treatment of COVID-19? And as a practicing physician, what are the vaccine concerns that you hear most often from Black patients and community residents?
You know, thank you for the opportunity. And we know, as you've heard, that COVID does not discriminate, but we know from the very beginning that there have been inequities. And these are not new. The Foundation for Health Inequities was there long before COVID hit, but we know Blacks were impacted, Black and other people of color were impacted significantly, both in cases, hospitalizations, and deaths. There have been surveys that have shown that Black people of all groups know someone who's died from this disease. And I appreciated hearing Dr. Alex's story about contracting COVID. The reason we have these disparities is related to the structural racism, income inequities, and a lack of resources in the Black community. Because there's now a vaccine, it's very important for the groups that are impacted the most to get the vaccine. We know that COVID-19 does not play, and we say get your vaccine today. But there are some concerns in the community. And I'm a person, I like to know if someone doesn't want to get the vaccine, why is that? So some of the things that I've heard, and one of the most perplexing one to me is that a chip will be injected into the person's arm. And I've asked people, well, if a chip is injected, what will the chip be doing? Is it gonna take a picture of me in the shower? Won't be worth much. Or is it gonna go into my bank account? So that's one of the things that was circulating through Facebook. There's also the issue of this vaccine was developed way too quickly. And I explained to people that the vaccine was put out there pretty quickly because we have a pandemic. We have a deadly virus that's killing lots of people. Over 500,000 people have died nationwide from this virus. So we've put a lot of money, manpower, and technology that we've known about to develop this vaccine, but no steps were skipped. All of the phases of the clinical trials were gone through, nothing was skipped. And so we hear warp speed, but there were no steps skipped. Also, one of the top concerns that I've heard from people is, are we going to be guinea pigs as Black people? We know about Tuskegee study is what the Public Health Service called it, but for our community, we call it an experiment because it lasted 40 years. But this is a different day and time. Tuskegee could never happen in this time. We have Black doctors and scientists that are helping to develop the vaccines, that help develop the vaccines, and they're overseeing the process to make sure that everyone's going to be safe. This is a safe and effective vaccine. So I'll stop there. There's many more things that people are concerned about, but we want to hear from the audience.
Great, thank you so much, Dr. Richardson. Yes, we do want to hear from the audience, and we'll get to that in just a minute. I do have one more question for Dr. Douglas. How easy is it to get a vaccine, and where can people go to find out information about getting a vaccine? Oh, you're muted.
Sorry, barking dog.
Okay.
It's gotten easier and easier over time. We started out with vaccines only in a few places because number one, we didn't have a lot of vaccine, and number two, the vaccine, this particular vaccine requires more careful storage conditions and freezers than we ordinarily see with vaccines. Those were a big headache. The amount of vaccine that's available now is such that you can go lots of different places. For example, all of the clinics, the tri-county clinics are serving walk-in patients. You can make an appointment if it helps you plan, but you can also literally walk in. And as of today, we're vaccinating folks 12 and up. We just expanded the vaccination ages a few days ago, 12 to 15. In fact, I got a text 3 minutes ago. My wife gave my granddaughter her vaccine, which is ironic while we're sitting here talking together. You can also call our call center, 303-220-9200, 303-220-9200, and get more detailed information about both where you can get it, and sometimes if you're having trouble making an appointment, helping getting registered to have that appointment made. The last thing I would say is that I just tried it out before we got together this morning. The federal government set up a text vaccine finder service. If you text into your phone, get vax, which is, or the numbers 438-829, and put your zip code, you'll get 3 close to your house vaccine sites that'll pop up. It took about 3 seconds. You can then hit a link and get another 100 vaccine sites within 50 miles of your house. So it's really gotten, the supply is much greater, and the ability to actually find these places has improved dramatically. So that really, while it has been an issue in the past, should not be a barrier now that we've got so much vaccine available.
Is it okay if I add to that real quickly, just very quickly? And if people are looking for community trusted places to go get vaccinated, the Dayton Opportunity Center in Aurora, that's ran by State Senator Rhonda Fields, is doing vaccinations. The Second Chance Center is doing vaccinations. The African Leadership Group is doing vaccinations today at their facility. And the Ethiopian Orthodox Church was doing that. I think they're still doing vaccinations as well. So if you feel like you want to be with community, those are some places you can contact as well.
Great, thank you. Our first question is, why can't I just wait to get the vaccine? So I know that it's safe. What is, what are the issues with waiting? Dr. Alex, do you want to answer that one?
Yeah, no, I think that's a really, really good question. And I think that first and foremost, one of the most important things to remember is that everybody's thoughts, questions, concerns, they are 100% valid, because what we're talking about is your body, okay? And so that's what I want to say is all your questions are always valid. The way that I would think about kind of everything we've talked about is, almost imagine that you're driving on a highway, right? And you have these various barriers in place to protect you. Consider social distancing, like wearing a mask, consider social distancing, like paying attention to the steering wheel. Consider getting the vaccine, like wearing a seatbelt. Consider, keeping your distance, washing your hands, like the rails on the highway. The idea is that you never want to get into a car accident. You'd want to avoid that at all costs. But sometimes a car accident will happen. And if you have those various mechanisms in place to protect you, the likelihood of you doing okay, the likelihood of your survival is significantly, significantly higher. Meaning that the vaccine itself will protect you. Because again, I was in my 30s with no medical problems, and I ended up in the ICU thinking that I would never see my family again. I never once anticipated this was something that could ever happen to me. And there were so many patients that I've taken care of who are otherwise young and healthy, but also with various health problems who, again, never thought it would be them. It's one of those, I never thought it would be me, but it is them. We've lost over 500,000 of our colleagues, of our friends, of our family members, and those numbers are still going up. And again, this isn't just within a small microcosm. This is going on around the world. And so the other thing I would say is, with the vaccine, when you get the vaccine, not only are you protecting yourself, but you're protecting those around you, your family members, your communities.
Oh, it looks like you may have frozen a second. All right, we'll go to our next. Dr. Enurah, we can't hear you for some reason.
I completely understand, many of the hesitancy, but I recommend trying to get the vaccine as soon as possible to protect you and your loved ones.
Great, thank you. Our next question is for Dr. Richardson. I want to get the vaccine, but I'm a little nervous about the side effects. Will I miss work because of the vaccine? Can you tell me a little bit about that?
Sure. And with this vaccine, it's kind of variable what sort of effects it may have on you. Some people may just have a little sore arm for a day or so, or even shorter on the second one. It's true that some people have a more vigorous response, usually the younger people. It's just kind of natural to get some of these effects because of your immune system, as was mentioned, is starting to be revved up. So you can get fever, fatigue. Some people even have lymph node enlargement. So if you're going for a mammogram, you might want to delay that. But there's no way to predict who's going to get these symptoms. We know they can happen. So I've encouraged patients to try to make sure you plan accordingly. If you're off on the weekend, maybe try to get your vaccine near the latter part of the week so you don't have to miss as much work. And we hope that all jobs are supportive of people getting this vaccine and know that you could possibly get sick for a few days after that. But certainly this is not anything abnormal. You may even get a little redness. You may get fever, fatigue, headache. You may feel like, hey, I've got COVID, but you don't get COVID from the vaccine, but you may feel that way. But just try to plan in advance and know that no one can tell you exactly what kind of symptoms you'll have, but you could have some, and that's normal. Thanks. And one other thing I want to add is I like what Dr. Kizzmekia Corbett, who is one of the developers, an African-American scientist that developed the vaccine. And she said, getting the vaccine, getting vaccinated is community service. So you're doing it not just for yourself, but for your community, for our community. I encourage all people to think of it that way. It's not about you, it's about the community, our family.
Great, thank you. Our next question is, I've already had COVID-19. Do I still need to get vaccinated? Dr. Douglas, can you answer that one?
Yeah, sure. If I could add on to Dr. Richardson's response, the state does have a policy in place that you're allowed to take sick leave to go and get a vaccine, and you're allowed to take sick leave if you have a side effect. So if you have a job and you're worried about, oh, I'm going to miss a day of work, it's embedded in state law that you're protected. Your employer is required to let you go get the vaccine, required to let you recover. So please be aware of that. I'm sorry, Becky, I wanted to add that. I've spaced out what you asked.
That's okay. So I've had COVID-19 before. Do I still need to get vaccinated?
Yeah, really good question. Because we estimate that about 35% or so of folks have already had COVID. Some know it, many, as Dr. Alex said, had gotten it asymptomatically and don't know it. But the answer is you are probably immune for at least several month period of time after you get COVID. But every evidence we have from other infectious diseases, and certainly from COVID, is that vaccine-related immunity has a good chance of lasting longer. It also appears to be broader. And what I mean by broader is you've probably begun to hear about the variant strains of virus that are circulating. There's one from England, there's one from Brazil, there's one from South Africa. We have a new one from India. And it looks like the vaccines that we're currently using in the US cover all of these strains much more effectively than natural infection would. So overall, yes, if you've had COVID, please get the vaccine. It'll probably give you longer lasting immunity. And it does appear to protect more effectively against the new strains that are beginning to show up.
Great, thank you. That was actually, we had a question about the variants, so thank you for working that in, appreciate that. This next question is, I'm not sure who should answer this. I've never gotten the flu shot, been healthy, I've never gotten the flu. Why should I get the COVID-19 vaccine? Dr. Alex, you want to try that one?
Yeah, no, thank you. I think that's a really good question. And again, what we've been seeing in the hospitals and the clinics is that, again, a lot of people who are otherwise healthy, who've otherwise never needed or had contact with the healthcare system, are coming in very, very sick. And then a lot of times when they're sick in the hospital, that means that their family had been exposed as well. And then a couple of days later, mom, brother, dad, sister may then start developing symptoms as well, and then they may end up coming to the hospital. getting the vaccine will give you immunity to it. And that's going to be the most important thing. It's going to be the step of how we get back to a new idea of normalcy. With having more and more people protected, that means that the virus has a less and less likely chance of being able to go and get to people who aren't able to get vaccinated. And so when you get a vaccine, again, you are protecting yourself foremost. You're protecting those members in your immediate family who live with you, who you see. You're protecting your colleagues that you work with. You're protecting the friends that you keep. You're protecting your community, your congregations. As Dr. Richardson was saying, it's not just protecting you, but it protects the community. It helps each other. And so if we're on the fence of saying like, well, I'm just not sure that I really want to get the vaccine for me, think about your parents, think about your siblings, think about your family, think about your children, think about your neighbors, think about your coworkers. These are the people who are affected. The way to think about this is just think about throwing a stone in still water. When it hits down, you have no idea how far those ripples are going to go. It's the same thing with getting vaccinated. You have no idea that a decision that you make, how it's going to affect people far and far and far away, but also really close by.
Thank you. Our next question is, I have a pre-existing condition and I'm scared the vaccine will make it worse. Should I still get the vaccine? Dr. Douglas?
Yeah, sure. That's a really important question because frankly, the vaccine is probably most important for people who've got various pre-existing conditions. And so they're right to wonder if there are going to be interactions or complications. We certainly know that for some medications, for example, people who with underlying diseases may react differently. As it turns out, both in the clinical trials, which as Dr. Richardson said, were conducted as thoroughly as all vaccines involving tens of thousands of people. And now the subsequent experience is that the vaccines do not appear to interact with any pre-existing conditions. They do not appear to exacerbate any pre-existing conditions. There are some pre-existing conditions for which there are questions as to whether the vaccine works as well. So for example, people whose immune system is impaired by having an organ transplant, like a kidney transplant, and taking medication to not have the organ be rejected, or perhaps people with HIV infection, or perhaps people undergoing cancer therapy, they may not respond as well to the vaccine. That's an area of active research right now. It's one reason that I would tell people in that category to wear a mask to protect themselves and give them added protection, but it does not appear to mess with the underlying disease. So unless you have had a very severe allergic reaction specifically to the vaccine itself with your first dose, or a known component of the vaccine, such as something called polyethylene glycol, which is a pretty rare reaction, you shouldn't have concerns about being too risky or your medical condition being too risky to receive the vaccine.
And I just wanted to quickly piggyback what Dr. Douglas had just said. From what we've seen and experienced, the people who have underlying conditions who get COVID-19, those are the ones we're most worried about. Those who do have COPD, asthma, heart disease, those who are diabetic, those who are immunocompromised, those are the ones that when they come into the hospital, we are particularly worried and concerned. And so those, I would say to anyone who does have underlying conditions, consider yourself higher at risk for if you're exposed and get COVID-19. And so for you, again, it's always, weighing, risk versus benefit, but the risk of not being protected, the risk of getting COVID-19 is very, very high. And that was just what I wanted to add.
Thank you. Our next question is for Dr. Richardson. I didn't feel good after getting the first shot. Do I have to get the second one?
You know, for the, and let's just start out with that. The Johnson & Johnson is one shot only, but both the Pfizer and Moderna require 2 shots to be fully immunized. So we definitely are encouraging people to get the second shot. I've heard some people say, oh, I don't want to get sick. I'm not going to get the second shot. But for full immunity, you really need to get both shots for the Moderna and the Pfizer. Just kind of prepare yourself, take a few days, as I said before, strategize about when you're going to get the vaccine, the second vaccine. You don't know, you may not have the same reaction. It could be worse, it could be better. There's no way to predict. But what we can predict, if you get COVID-19, you can get very sick and you can die. So it's worth being fully immunized. So get the second shot. I want to tell my little story of getting the shot. I was preparing. I got the first one. My arm was a little sore. On the second one, I said, am I going to have to miss work? Am I going to be off 3 days? I went to bed. I was still feeling okay. And I woke up, darn, I'm going to have to go to work. I didn't get sick. So you can't anticipate, but what we can anticipate is that COVID is a bad disease. We're still in the pandemic. And to be fully immunized for the Moderna and the Pfizer, you must get 2 shots. The Johnson & Johnson is 1. Don't worry about the side effects. They won't last forever. It'll be short term.
Great, thank you. There was one question about the vaccine changing our DNA. And I think you touched on that, Dr. Richardson. Can the vaccine change our DNA?
The vaccine does not change your DNA. And you're referring to the mRNA or the messenger RNA. That's what Moderna and Pfizer are. And they definitely do not enter your nucleus. They don't affect your DNA. And you do not get the virus from getting these vaccines. You have a little piece of the spike protein that your body is reacting to, but you don't get the virus from the vaccine, and it doesn't affect your DNA. I'm repeating that a lot because that is one of the urban myths, that it'll affect your DNA. So anytime I have the opportunity to tell people that is not true, these are some tremendous vaccines when you learn about the technology, but it will not impact your DNA. It will not affect your DNA.
Great, thank you. We have one more question. I've had the vaccine, but now that it's available for kids, I'm a little nervous about getting my kids the vaccine. Is the vaccine just as safe for kids as it is for adults? Who would like to answer that question? Dr. Douglas? You're muted.
Happy to. Let me clarify that, like Dr. Enurah and Dr. Richardson, I too am an internist, which means we all take care of adults. So I'm not a pediatrician, but I will tell you that the work that's been done on pediatric vaccines has been astoundingly reassuring. The recent expansion of allowing kids 12 to 15 to be vaccinated was based on a study of a couple thousand kids. The side effect profile looked very similar to that in older adults, except it was less. They didn't get as much of the sore arm sort of thing that Dr. Richardson talked about. Amazingly, the vaccine in the study of 12 to 15-year-olds showed the vaccine to be 100% effective. 100% effective. So it was astoundingly effective in those kids. Again, over time, it may turn out not to be quite that high, but it was very powerful. And part of the reason we think it was so powerful is when you measure blood samples from the kids in the studies in the laboratories and ask how strong is the immune response. Like other vaccines, it's even stronger than it is in adults. So kids have got this really strong immune system, and it does great with vaccines. So we will learn more over time. I do want to point out that when you do a clinical trial of 10,000 people or 2,000 people, it's fair to say, but that's different than giving it to millions of people, isn't it? And the answer is yes, it is. And just like with the J&J vaccine, it took millions of doses to begin to recognize that there probably was a very rare problem with blood clotting. And it was picked up because we've got such incredibly strong surveillance systems for looking for adverse effects from vaccines. And we're talking, in the case of the blood clot, things that were like 1 in 100,000 or 2 in 1 million. you're never going to find that in a clinical trial, but because for vaccines, we monitor things more carefully than we do almost anything in society. We monitor them more carefully than we do medicines. Frankly, we monitor them more carefully than we do bridges. I just heard about a bridge in Arkansas that's got a big crack in it. It's going to have to be closed down. We know we have an infrastructure problem. That doesn't happen with vaccines. Vaccines are being incredibly carefully watched. So it does appear that we have got something that works really safely and effectively in our kids. And it's really great for you as a parent who's had the vaccine to share that privilege with your kids now.
Can I just ask a question to Dr. Douglas about the vaccine for the kids right now? I believe it's only Pfizer, so that may limit some of the availability of where you may be able to get it. Is that correct? Because I believe that's the only one so far that's received emergency use authorization for 12 to 15-year-olds.
You're absolutely correct, Dr. Richardson. In fact, Pfizer was the only one that was authorized for 16 through and 17-year-olds originally as well. That makes it a little complicated. The kids can't get a one and done Johnson & Johnson vaccine. It is Pfizer. And when you look on these various sites to find where you can get a vaccine, it's very easy to tell which vaccines are being offered, but it is only the Pfizer vaccine. I will say that the Moderna vaccine has got studies underway in younger people, and I expect that by the end of the summer, we'll be having emergency use approval for younger kids with that vaccine as well.
Great question. Thank you for bringing that up. Okay, well, I just wanted to say thank you on behalf of all of our organizations for being here and sharing your wisdom and stories with our community. And I'm gonna go to each one of you and let you have a final say before we wrap it up. So Dr. Enurah.
Yeah, well, again, thank you so much for joining us, and thank you for hosting this event. One other thing I wanted to, bring up too is, something that we've seen as well are, some of the terms that are used are these long haulers, basically people who have these symptoms because of COVID-19 that lasts into weeks and months, whether it be fatigue, mental fog, muscle aches. So, one of the concerns with getting COVID-19 is with the initial concern of death, which is always huge, there's also the concern of how getting this infection will affect you long term and for how long. And so any way to protect yourself is, worthwhile. I do believe that we are getting closer and closer and closer to getting back to whatever normal life will look like. 2020 has taken a toll on all of us, and COVID-19 has affected everyone either one way or another. Whether you had COVID-19, you knew someone who had COVID-19, it's affected our education system, businesses, the economy. It's affected the world. The kind of one last thing I just wanted to say is, it seems that everything had happened very quickly with the vaccines, the treatments. And the one thing I want to just kind of say and bring home is, as far as I know, there was never a time in history where the world basically came together and you had different organizations, institutions, government bodies, laboratories, all working on one problem at the same time. Because that's what the world needed. So the world called for that and it answered. And so that's how you have the rise of multiple vaccines at the same time. And so I know a lot of people feel a little uneasy of, why are there so many different vaccines to choose from? Is one better than the other? Is one the best? Why there's so many? And it's because multiple places, multiple institutions were all working on the same problem at the same time. Money and resources were being thrown at it to support it and fund it. And that's how we got to where we are today, with now having 3 different vaccines that are available. And right now, times have changed a little bit, that now you have a choice of which vaccine you can get. And so I believe it's worthwhile, with your individual questions, to talk to your primary care provider, to ask if is there a reason why one might be better than another in me. For example, Johnson & Johnson is just one vaccine, where for folks who don't have a lot of give in their schedule, that might be the way to go. Other ones may prefer to do the 2 vaccine set with Moderna or Pfizer. So my belief is we're going to get through this. I'm really honored and pleased to be here, and very honored to be among such esteemed colleagues today, being able to take and answer your questions. Thank you.
Thank you. Dr.
Thank you for the opportunity and partnering with Tri-County Health Department. I just want to share with the audience that vaccines are vital to us getting back to our life closer to the way it was before. But just having vaccines isn't enough. We need people to get vaccinated. I do believe it's your free will, your right to get a vaccine or not. But I believe that you're doing this not for yourself, you're doing it for the community. And we are here with the Colorado Black Health Collaborative. I wear a lot of hats, but with the Colorado Black Health Collaborative, we're here for you as well. If you have some additional questions, you want to get our perspective on things, be sure to reach out to us on coloradoblackhealth.org. We partner with Tri-County on other issues, but we're here for you. I encourage people to get the vaccine because COVID-19 does not play. So get your vaccine today.
Thank you. Dr. Douglas.
Yeah, let me just say, I mean, we practiced our presentation, but I've learned a lot from my colleagues that we didn't practice. What an honor to be with you guys. Alex, I'd forgotten you'd been sick. Terri, it's been great to be reunited with you after work at Denver Health 20 years ago. You know, I want to say a couple of things. We've talked a little bit about some of the urban legends and myths that are going around, and I want to remind our audience that we live in a time, unfortunately, where we not only have pandemic infectious diseases, but we have pandemic disinformation. And I think one of the things we've all got to kind of think about is that how we arm ourselves against sometimes innocently false information and sometimes deliberately false information. And whatever you're sort of hearing, please try to triangulate it with what you think may be reputable sources of information. Certainly we think Tri-County provides that, but we think the Centers for Disease Control, the FDA, the NIH provides it. Facebook has done a lot of great things for people connecting their lives, but it's been a massive channel for false information. You're going to see more myths coming along, and just please be prepared, because falling prey to those myths can take lives. People who believe that it messes with their DNA or puts a chip in them run the risk of being the next group of people who get sick or even die. So please, and this is of course not just, but be aware of that. I guess the second thing I would say is, I think it was Omar that mentioned earlier that many in our community are aware of the Tuskegee experiment that happened, you know, almost a century ago. Now, not quite. I was incredibly pleased. I worked with some of the Tuskegee survivors when I was at CDC, and I was really pleased to see that some of the survivors' grandkids actually went out and have gone on record saying, hey, community, please get vaccinated. Don't let what happened to our grandparents who didn't get care affect what could really be important to you today to get care. Again, I think it's such a strong plea. And the final thing I would say is, as my colleagues have said several times here, this vaccination is going to help you personally with your health. It's going to help your loved ones in your community. I love the image of the rock in the pond, Alex. And finally, it's going to help you get your freedom back. When you get vaccinated, you've got so many more opportunities given your immunity to get your life back and to do the kind of hugs that that Omar talked about. So I really appreciate being on this panel and appreciate our audience and their great questions.
Great, thank you. Mr. Montgomery, if you would be so kind to close us out and give us our final word for today.
You know, I just want to say thank you all for providing the wealth of knowledge to the community. I think it was Dr. Richardson that actually brought up the Tuskegee experiment, and Dr. Enurah. I will say this, my grandmother was born in the South, and my grandparents were born in the South during the time of Jim Crow, where you didn't have ready access to healthcare. where, you know, sometimes he was just in the basement of the church with somebody who knew something about medicine to help you get through the day. Today, look at us now. We have a lot of doctors from our community that are out there trying to let us know the correct information. I'm going to repeat that, the correct information. We're talking about people that the community has stood by and watched them go through high school, watched them go through college, and then watch them go through medical school and come back and say, hey, I want to do my job to uplift the community and make sure they have the correct information regarding their health care. With that stated, I look forward to all of you getting healthy beyond COVID. Let's get out there and exercise. Let's get out there and address diabetes. Let's get out there and address breast cancer. Let's get out there and address prostate cancer. Because Dr. Enurah, as I begin to close, you said something that was extremely important. The world came together to address COVID-19. Imagine if the world came together to address the environment, public health, to eradicate disparities so that we all can live a productive life. That is the world I'm looking forward to. And unfortunately, COVID-19 is a bad situation, but a positive byproduct may be all of us coming together to make this world a better place. Thank you.
Thank you so much, everyone. Have a wonderful day. Thank you.